All right, we are back, our final full segment as we talk about the Vanderbilt Child Health Poll, the third year that this research team has put together some really interesting survey results from Tennessee parents about our kids. And like Dr. Patrick, our guest, said, we want the best for all kids here in Tennessee. They're the future, and we want them to be happy and healthy, and we know this has been a tough time during the pandemic. So specifically now, Doc, I know that there's a lot of similar results that you found across the state, a lot of kind of baseline results, but there were some stark differences. Earlier, we looked at a map of Tennessee, the 3 grand divisions, and saw some differences there. I'm sure you saw some different responses from urban areas to rural. We're going to break it down now a little further and take a look at race, because there were some stark differences between white parents and African-American parents, right?
That's right. We see education and school quality is still consistent, but we see much more worries about getting sick from COVID, racial inequality, gun violence, and injuries. It's still, again, bullying, including cyberbullying, is on that at the top of the list. I mean, one thing that's stark here is that we see 1 in 3 Black parents are worried about racial inequality and gun violence, and neither of those make the list for white parents. And it just shows that the different experience that Black parents, their kids are going through too. So, I think it
stems off of. Then, if you look at the number 1 result, this would tell me that maybe in general the respondents have different ideas as to what their concern is regarding education and school quality, right? For a Black parent versus a white parent. Overall education and school quality may be a different kind of meaning to them if you look further down the list and see the racial inequality, gun violence, and injuries, and it's nowhere on the other list.
Yeah, and look, we know from the data that Black and Hispanic kids and adults are more likely to get sick from COVID, and that's because they're disproportionately in essential jobs, and that makes them at higher risk for COVID. And so some of these concerns are just based upon the experiences that they have, and the data bear that out. And so, this is why we need to make, as you said earlier, Tennessee a good place to be a kid for all kids,
right?
Based on their unique experiences.
When you ask these questions, when you get someone who agrees to take part in this, how far down do you dig as far as demographics? I mean, do you get, obviously, do you get economic information? What's their economic situation? That far down?
Yeah, we do get some of those data. In fact, like the way we're sampled is we sample to kind of match the population. So
right.
We use U.S. Census data to match on race, income, education, things like that, so that we can get a sense of, we want to make sure that we have a representative sample of Tennesseans.
Well, it's like TV ratings. When people ask me, how do you do TV ratings, or how do you know? From just, I don't know how many, I forget how many people are surveyed, but it's a low number compared to the overall viewing audience. How do you get that right? I said, well, it's a representative sample, just like you. So over a little more than 1,000 parents, right?
That's right.
That you talk to. How long did this typical survey take? For
about
someone?
10 minutes.
Over the phone, I assume?
No, so we do this electronically. So the panel is, the reason why we do it electronically is a lot of people don't use the phone anymore. There's a few landlines. Right. I know when I get a call on my cell phone that I don't recognize, I don't answer it. Yeah. So this is an intentional sample that is created and if for folks who don't have access to the internet, they're given access to the internet. And so we work with a group that does that so that we can have a pretty good sample, and it can be pretty rapid too.
Oh, great. So how long does from start to finish, when you start working on, what are we going to ask? Obviously, you want to ask similar questions from the year before, so you have comparative data, but there may be other things you want to ask about. How long does that whole process take for your
us,
team?
It's a couple Yeah, a few months, and then we work to try to engage others too, not only pediatricians but also the community. So we had a Tennessee Parent Leadership Group from Nurture the Next that helped inform some of the questions. In fact, this year the reason why one of my favorite things about the poll that we did this year was looked by the Tennessee regions, and that came from the advice of parents. And so we work through questions, we look at kind of things that have been relevant to kids, and we look forward to things that we think may be an issue in the spring too, so that we can have some data that we bring to both the legislature and issues like that.
All right, I want to bring that graphic up one more time before this segment ends, if possible, just to look at the differences again. So how do you, when you come up with something like this that shows some stark differences, how do you then report that to policymakers?
Well, just like this.
Yeah,
I mean, there are some things that we sort of highlight. If you look at kind of our report that is longer and in context, for example, looking at differences by race on other factors like changes in insurance and food insecurity. We intentionally look, we oversample for Black families to look at issues of equity when we look at some of the issues that families are facing. So it sort of depends on what we have and what we find. So we work to put it in context, but for this year's release, one of the things that we are aiming to do is just put the data out so people can react to it and move forward. You're right that some of the data that we get moving forward is going to be a bit more specific and actionable too.
Now, what were there stark differences about masking and vaccines between Black and white parents?
Yeah, the poll results that we released yesterday about parents' attitudes and beliefs about masking and vaccines in school, we see big differences. So about 90% of Black parents send their kids to school in a mask compared to about 60% of white parents. So a pretty big difference there. Black parents are far more likely to believe that their students are safer when their teachers mask and believe that teachers should be vaccinated. So we do see differences there by race too.
Have we made any progress with minority groups in Tennessee getting vaccinated, children and adults?
I think we have a long way to go in the state of Tennessee for all populations. We still have a pretty low rate of vaccination in the state of Tennessee among all populations. And, look, one of the things that we looked at last year and we're going to put out later on this year is trying to get at that a little bit. Like, why is that? Do we have issues with trust, and who do people trust for their sources of information? Consistently, we still do see that Tennesseans trust their State Department of Health and the Centers for Disease Control, right. Even as we talked through earlier, recommendations changing over time.
Fascinating. All right, Emila, what's our out time here? Just checking. Okay, we got like 2 minutes left. I want to make sure you can put out the information where parents and others can go to look a little more in depth at this. Where can they go online for this?
Our website is www.childpolicy.org/poll. And that's where you can see our poll results from the last 3 years in Tennessee. In 2020, we also did a national poll to understand disruptions that were happening with kids too nationally. So those data are there as well.
Are there similar polls happening in other states? And do you share results with each other and look at what maybe Texas or California or whatever, Colorado is doing?
I don't think there's actually similar polls quite like this. There's a national poll at the University of Michigan that asks kind of questions about kids nationally. It's a little bit different. This is the only one that I'm aware of that is kid state-based. Census does some, U.S. Census does some polling of parents to understand issues like food security and insurance over the long term, but this is pretty unique to Tennessee, I think. All
right, and before you leave, overall, what would you like to see in Tennessee, actionable, as a pediatrician, actionable steps to just kind of improve children's health this year?
Okay, well, look, I think we need to be in schools. We need to be talking about vaccines more and kind of beyond. And we need to be having open, honest conversations in communities. I think this extends to our churches too, places where we connect. Kids need to be in school, so we need to be doing the things to keep them in school, and that still continues to be masking. But I also think we need to look beyond and look towards improving issues of mental health understanding the unique needs that our Tennessee kids have, and push forward on that. The last thing I'll say is, like, look, we just need to have an agenda for kids and elevate the voices of kids, and when we think about policy making, because oftentimes their voices are lost.
Doctor, thank you so much. Appreciate your time, and hope to see you soon. Have a good night, and we'll wrap things up right after this.